Hello, everyone. Today, we're talking about a very serious topic, involuntary seclusion. It's something many people might not fully understand, but it deeply affects vulnerable individuals. We need to shed light on this issue. So, what exactly is involuntary seclusion? It means isolating someone against their will. They are physically separated from others. They have no choice in the matter. This isolation is often imposed by a caregiver or an institution. It is not a voluntary timeout. It is not a therapeutic intervention. It is a restriction of freedom. Let's look at some key characteristics of involuntary seclusion. First, it is always non-consensual. The person does not agree to it. Second, it involves physical isolation. This might mean being locked in a room. It could also mean being confined to a bed. Or it might involve being left alone in an area with no access to others. Third, the person has no control over when it ends. They cannot simply choose to leave. Fourth, it often causes harm. This harm can be emotional. It can be psychological. It can even be physical. Who is most often affected by involuntary seclusion? We often see this happen to elderly individuals. People with disabilities are also at high risk. Children can be victims. Patients in healthcare settings might experience it. Essentially, anyone who depends on others for their care is vulnerable. They might not be able to speak up for themselves. They might not be able to physically resist. Why does involuntary seclusion happen? Sometimes, it's a misguided attempt at behavior management. Caregivers might lack proper training. They might not know how to handle challenging behaviors. Other times, it's a result of neglect. It can be a form of abuse. It might be done for the caregiver's convenience. It's easier to isolate someone than to provide proper care. This is never an acceptable reason. The impact of involuntary seclusion is severe. It causes deep psychological trauma. People can develop depression. They might suffer from anxiety. Fear becomes constant. They lose their dignity. Their sense of autonomy is destroyed. Trust in others is broken. Physical health can also decline. Lack of stimulation is harmful. Basic needs might be neglected. This practice is a clear violation of human rights. It is a form of elder abuse. It is child abuse. It is abuse of people with disabilities. How can you identify involuntary seclusion? Look for signs. Is a person always alone? Are they restricted from common areas? Do they have limited or no visitors? Do they seem withdrawn? Have their moods changed dramatically? Does a caregiver seem overly protective or controlling? These are all red flags. If you see these signs, pay attention. What can you do to help? Speak up if you have concerns. Do not stay silent. Report your concerns to the proper authorities. This could be Adult Protective Services. It could be Child Protective Services. An ombudsman might be able to help. Educate yourself and others about this issue. Advocate for better care practices. Support organizations that protect vulnerable people. Every person deserves to live free from isolation and abuse. Thank you for watching and learning about this important topic. If you found this information helpful, please consider supporting the channel. Your support helps us create more content like this.